this segment, we're gonna discuss the meninges, the dural spaces, and the different types of hemorrhages that can occur in these dural spaces. The central nervous system is the most precious system in the whole body. So we have to protect it. And in order to protect it, like when you get a very precious gift to someone, you wrap it in a very nice wrapping paper. So the brain is wrapped in 3 layers of meninges, and so the spinal cord is also wrapped in 3 layers of meninges. Actually, they are the same layers, they extend downwards. So 3 layers wrap the brain and extend downwards to wrap the spinal cord. And these are the meninges. And if this part is the brain, and this outer area, this is the skull. So the 3 layers of meninges from without inwards. So the 1 layer of meninges that is closer to the skull, that is in relation to the skull, is called the dura mater. Dura in Latin means tough or strong. Mater means mother. So this is the strong mother. This layer, the outermost layer of the meninges, has to be strong. Why? Because it is in direct relation with the bone, whether the skull or the vertebral column for the spinal cord. So it has to be tough to tolerate the friction with the bone. So we call it the dura mater. Next to the dura mater is the arachnoid mater in green. And arachnoid means it has villi. And through this villi, the CSF, the cerebrospinal fluid, is absorbed. The innermost layer of meninges, which is in direct contact with the brain or spinal cord, has to be very delicate, very tender, very soft. Why? Because it is in direct relation with the most precious organ in the body, the brain, and its continuity, which is the spinal cord. That's why we call it pia mater. Pia in Latin means soft, tender mother. So this is the soft or tender mother. So we have 3 layers of meninges. The 3 layers of meninges create 3 dural spaces, 3 spaces. The first space is between the dura mater and the skull. So the first space is actually above the dura, or outside the dura. So we call it epidural space or extradural space. Epidural space or extradural space. Extradural space. This space is normally empty. It does not have any fluid. So it's a potential space. What does it have? It only has arteries and veins, blood vessels. So we have only blood vessels here, arteries and veins. If one of these vessels is cut for whatever reason, most common reason is, of course, trauma, head injury, and one of these vessels is cut, blood will accumulate in the epidural space or the extradural space. What do we call this condition? We call it extradural hemorrhage or epidural hemorrhage. So what is extradural hemorrhage? Epidural hemorrhage, it's blood accumulating in the extradural space, the space outside the dura, the space between the dura and the skull. Now, this space has arteries and veins, but the most common source of an extradural hemorrhage comes from an artery. So extradural hemorrhage is usually due to arterial bleeding. Usually the one vessel that is injured in the extradural space usually is an artery. And there is one specific artery that is very commonly injured because it runs underneath the weakest point of your skull. Where is the weakest point in your skull? Now, I want you to tap here on this bone, tap gently on this bone. And also I want you to tap at the uppermost point of your skull, the vertex. Which part you think is thicker and stronger? The top part or this side part? Which part is stronger? The top part is very strong, actually. This is the strongest part in the skull, in the bone. And this is the weakest bone in the skull. This plate of bone, we call it the pterygoid. This plate is very weak. And actually underneath this part runs an artery called the middle meningeal artery. Trauma to the head trauma can easily fracture this bone. And when this bone is fractured, even if it is not fractured, because it's very thin, so trauma to this part is easily, can easily rupture and damage the middle meningeal artery. And this is the most common source of extradural hemorrhage. Okay, then the second dural space is the subdural space. As the name implies, it is the space below the dura mater. It is the space between the dura and the arachnoid. And again, this space is a potential space. It contains no fluid. It only has blood vessels. It has arteries and veins. And again, if a blood vessel of these vessels in the subdural space is cut for whatever reason, blood accumulates in the subdural space, and we call this condition subdural hemorrhage. And the most common source of bleeding in the subdural space is actually venous and not arterial. Okay, it can be venous or arterial, but most commonly it's a venous bleed. So which one you think, guys, is more dangerous? The extradural hemorrhage or the subdural hemorrhage? Which one is more dangerous? What do you think? Arterial bleeding or venous bleeding?
Arterial.
The what?
What's arterial bleeding?
The arterial bleeding is more dangerous. Why? Because arteries are high pressure system. If an artery is cut, blood is going to come out under high pressure. And this extradural hematoma can reach a very big size in a few minutes. And this size will compromise the brain function, will compress the centers in the brain, and can be fatal. Whereas the subdural hemorrhage, because it's venous in origin, so it might take weeks until it has reached a big size, big enough to result in clinical symptoms and to result in actual danger. That's why most of the time, the arterial extradural hemorrhage is life-threatening much more than the venous subdural hemorrhage. Then the third space is present between the arachnoid mater in green and the pia mater. And this is the only space that contains fluid. It contains the cerebrospinal fluid, or the CSF, and the cerebrospinal fluid is produced by the innermost part of the brain. And the function of this fluid, of course, is to provide like a cushion effect to protect the brain further. And it surrounds the brain and it surrounds the spinal cord as well. And this fluid is, by the way, this is the fluid that you get when you do lumbar tap. This fluid that comes out of the lumbar tap is the CSF. And this fluid normally is drained by the arachnoid villi that are present in the arachnoid mater. Now, again, the subarachnoid space, in addition to the CSF, it has arteries and veins. It has arteries and veins. And if these arteries or veins are damaged, what happens? Blood will accumulate in the subarachnoid space. What do we call this condition? We call it subarachnoid hemorrhage. Now, if the source of bleeding in extradural hemorrhage is mainly arterial, and in subdural hemorrhage is mainly venous, what is the major cause of subarachnoid hemorrhage? Arterial or venous? And the answer is arteriovenous malformation. What is this? arteriovenous malformation. Let me explain this using the whiteboard. Normally, the wall of an artery is thick because the artery is a high pressure system, and the wall of the vein is thin because the veins are low pressure systems. And in between both, we have the capillaries. And actually, capillaries are the reason that reduce the pressure in the veins. So when the blood is moving here in the artery under very high pressure, when it moves through the capillaries, the pressure becomes very decreased and reduced, and the pressure in the veins is low. So this is normal. Imagine if we didn't have capillaries. We only have this thick wall artery in direct continuation with the thin wall vein. So nothing will reduce the pressure. And now you expose the venous walls, the wall of the veins, you expose it to very high pressure. So what's going to happen? An aneurysm will develop. What's an aneurysm? It's a dilatation. It's an outward dilatation. So something will pop up here like this. Okay, and this does not happen at one spot. It happens at multiple spots, and we get something like what we call aneurysms. Aneurysms. This is, of course, a congenital malformation. And we call this arteriovenous malformation. Arteriovenous malformation. It can occur anywhere in the body. You can get these kind of aneurysms anywhere in the body. But the most common site for these aneurysms is in the subarachnoid space. Of course, these aneurysms are like a time bomb. You don't know when it's going to explode. You don't know. They can explode out of the blue. And when they explode, they produce subarachnoid hemorrhage, which can be fatal. And because they are congenital anomalies, so they might result in this subarachnoid hemorrhage at a young age. So kids who die suddenly, they were at school and all of a sudden they died. They collapse, get comatose, and die. This is ruptured aneurysm resulting in subarachnoid hemorrhage. Okay, so to review, the major source of an extradural bleed is arterial. The major source of a subdural hemorrhage is venous, and the major source of subarachnoid hemorrhage is the arteriovenous malformation or rupture of a aneurysm. Now let me talk about the clinical picture of each one of these. And let me start with the extradural hemorrhage. Extradural hemorrhage usually results from head injury, head trauma. And the immediate response of the brain to any head trauma is you get concussion. What is concussion? Let me see how I can explain it. So let's say that this, you see this box, guys, that I hold? Can you see it?
Yes.
Okay, let's say that this is the skull. And inside the box, I'm gonna put this clicker, and let's say that this clicker is the brain. Or let me okay, this kind of remote, I'm gonna put it, this is the brain inside the skull. So when you have head trauma, what happens to the brain inside the skull? It shakes, and this is concussion, and this is concussion. And classically speaking, any concussion should be associated with loss of consciousness, even for a few seconds, And this is the most common type of head injury, of brain injury, concussion. The brain shakes inside the skull as a result of the trauma. So extradural hemorrhage, it starts with temporary, brief loss of consciousness due to concussion. So a player in a football game gets injured in his head trauma, and he falls down, he loses consciousness maybe for 5 seconds. And when the brain recovers from this shaking effect, when the brain recovers from consciousness, the person regains consciousness again. Regaining of consciousness. And then, but the patient regains consciousness not knowing that an artery is torn in the extradural space, and now blood is coming out in jets out of this injured artery, and a hematoma is producing. A hematoma is developing, and it's getting bigger and bigger and bigger and bigger until it has reached a size that will compress the brain, will compress the centers in the brain, will push the brain downwards, and the brain stem is pushed downwards through the big foramen at the lowermost part of the skull, which is called the foramen magnum. And this, we call it herniation of the brain. And this is very dangerous, guys, and it leads to permanent terminal loss of consciousness. Permanent and terminal loss of consciousness. And if this patient is not saved by an urgent surgery, this patient is going to die. So this regaining of consciousness, it's a period between 1 and 3. In 1 and 3 here, there is loss of consciousness. But this period is the very nice period. It's like the honeymoon. So we call it the lucid interval. The lucid interval. In the lucid interval, the patient is awake. The patient is conscious, okay? And it occurs between the temporary, brief loss of consciousness due to concussion and the permanent terminal loss of consciousness due to brain compression. And knowing this can explain this very important recommendation. Whenever you have patient with head injury, especially those who give history of brief loss of consciousness, never discharge them back home until you verify no hemorrhage, until you do CT. Don't allow them to get out of the hospital until you make sure that there is no bleeding, because you can say, but the patient is talking, the patient is conscious. Maybe he is in the lucid interval and you don't know. And by the time he gets back to home, he collapses because of this brain compression. So this is the extradural hemorrhage. Now let me move to the subdural hemorrhage. Sorry, subdural, yes. Although subdural hemorrhage can be due to arterial bleeding, but most of the time it occurs because of a venous bleeding. And It's more common in old age, because in the old age, the vessel wall become kind of fragile, so they can easily rupture. And maybe they rupture due to minor trauma, just a minor trauma happens and they rupture. And in the old age, we have some sort of brain atrophy. So the brain is smaller in size. The brain is smaller in size, which means what? You have a lot of space now in your skull because the brain is getting smaller, smaller, smaller. So there is a big space in your skull. And this venous bleeding, it occurs very slowly and it can reach very big size. And therefore, the symptoms, the manifestations of subdural hemorrhage are very gradual. So the typical clinical picture, the grandkids are getting their grandpa or grandma. We don't know what's wrong with them. They seem to be less responsive. They do not talk as much. They sleep too much. Sometimes we have to shake them to wake them up. And when we talk to them, they don't respond right away. Maybe some of them develop incontinence, maybe some weird manifestations with mainly altered level of consciousness. They are not as conscious as they were before. And when you do CT, you find huge hematoma in their skull. This cannot be extradural. This cannot be from arterial bleeding. This is most probably subdural from venous bleeding. And because the brain is small, atrophied, so that's why it reached this very big size. And that's the typical clinical picture of subdural hemorrhage. I'm going to end this segment here. And in the coming segment, we're going to talk about the subarachnoid hemorrhage.